and welcome to the County Executive's weekly press briefing. As usual, we have Dr. James Bridgers here to report, as well as Dr. Earl Stoddard and Sean O'Donnell, who will provide information as well on COVID. Just to make sure that you all remember the protocol, please, if you have any questions, put them in the chat so that we can recognize you in order. If you have not gotten permission to record, please let us know as well in the chat so we can get you squared away. So without further ado, I will hand it over to County Executive Elrich to give his opening remarks. County Executive.
Thank you. Thank you all for joining us for our weekly media briefing. I want to start first with a quick note that this is the beginning of the Lunar New Year celebration for our Asian communities. It's the year of the tiger. We all know that the Asian communities play an important part in Montgomery County. They are one of the largest minority groups in the county and play a role in so much of Montgomery County life. Throughout this pandemic, we've witnessed our Asian communities face threats and acts of hate. And as a county, we've stood united and supported these communities through difficult times. And so it's important for the Asian community to understand that this county is united in supporting them. We are going to do everything we can to protect them from acts of hate and violence. And we do value your presence here in Montgomery County. I also want to note that this is the beginning of Black History Month. And it's unfortunate that this week we've seen our historically Black colleges and universities that they're operating in and educating people in a similar climate of fear. It's ironic that as we begin Black History Month, bomb threats have been made on campuses of several historically Black colleges and universities around the country. Thousands of Montgomery County residents have a connection to an HBCU, and some of the threats were at schools here in Maryland and in DC. These acts are unacceptable and frankly cowardly. My thoughts are with the students, parents, faculty, staff, and alumni of these important institutions. In addition to these threats of violence, our communities of color face legislative actions around this nation that would suppress their right to vote. There is nothing more fundamental to a democracy than the right to vote. And these acts continue to be an assault on our democracy, and they were encouraged by the previous president. The battles in communities to restrict the accurate teaching of our nation's past in our schools is yet another attack on Black history and culture, and it's an attack on American history. This month, I challenge all Montgomery County residents to research, recognize, and appreciate Black history and share it with your family and friends. The history of Black people in the United States is uncomfortable. It is filled with stories of mistreatment, disrespect, oppression, violence, and injustice. Our society suffers more harm from our refusal to deal with the truth about our history than could ever be done by actually understanding what happened here. This is nothing less than a continuing effort to obscure the past so that people now don't have the information necessary to connect the past to the present and to understand what we must do to redress the crimes committed here. And it is a fact that crimes were committed here. This is not a secret, and it's not something that ought to be written out of our history books. The threats this week on HBCUs are emblematic of how Black people and their institutions have been treated throughout American history. This is why Black History Month is so important, and it is our time to discuss our past accurately, not a whitewashed version of our history. We need to honor Black history and the people and organizations who are truly heroes. And there are so many milestones that have led to progress despite incredible odds and systemic racism that we need to discover and learn about our new Black history makers and the next generation of leaders who are going to carry this torch forward. So this is an important time, I think, for people to reflect on how we got where we are. And I can guarantee you that not understanding how you got there is going to leave us without the tools to figure out what we do going forward. Moving on to COVID. As far as the COVID update this week, our average cases over the last 7 days have decreased by 53%. And the positivity rates decreased by 4 percentage points. Thankfully, Our hospital rates continue to decline as well. We've seen a 51% reduction in ICU and acute beds being occupied by COVID patients, down from 550 just 3 weeks ago to 281 this week. Although it feels good to be on the other side of the surge, we're still seeing case rates and positivity rates almost as high as we were last winter. Let's be clear, this virus is still out there, and it isn't time for us to stop using common sense. Since the beginning of this pandemic, we've watched several variants rise rapidly in the population and dissipate, only to be replaced by the next variant. While it's great that Omicron seems to be in decline, we must be careful not to be complacent. We'll continue to be vigilant and monitor and track variants as they emerge. Please expect and understand the policies will reflect what we need to do to keep everyone as safe as possible based on the conditions that we're working in. This week, jurisdictions across Maryland, as well as our own neighbors in Virginia, have been dropping their indoor mask mandate. I'm glad that the district in Prince George's County, like us, are being more prudent and continuing it a little bit longer. We're still not in a moderate transmission range, which is what we're hoping we arrive at pretty shortly. With the decrease in our transmission rates, we've also seen a drop off in testing. Testing at all county providers has dropped 50%. We appreciate our partnership with the state for an easy drive-through site at Montgomery College, Germantown, and they've seen quite a slowdown as well. And we are also hearing reports from our take-home rapid test distribution centers that the long lines and running out of supply rather quickly has not happened anymore. I was up in Poolesville this weekend and watched them hand out both test kits and masks to residents, and they had a steady stream of residents. I want to thank them for doing that work up in Poolesville. It's very, very important. We've distributed over 2 million rapid tests. That's how many we've ordered. I'm sorry, and we've put out. We've received 1,005,000 as of 125. That number's gone up. 945, almost 946,000 kits have been distributed, with an additional 196,000 allocated. And we have 290,000 rapid test kits provided to MCPS. So there's a lot of testing going on, and our rapid distribution has continued to be quite successful. We're approaching 1 million kits being distributed in just under a month. That's pretty incredible. February is National Library Lovers Month, and I just want to reiterate my appreciation to our county libraries and all our staff members and volunteers who've worked so hard to get these tests into the hands of our residents. I do encourage everyone to continue to test, whether at home or at any of our sites. It's quick, it's easy, it's painless, and it's important moving forward. On the front of vaccines and boosters, we're getting ready for FDA approval for vaccines that allow us to test our last group of residents, the young people under the age of 5. This will be our most sensitive age group, and we're working with our pediatric medical community on ensuring that we have a system of vaccinations in place. However, I'm concerned about our declining booster rate. We've got about a 60% decline in additional doses since our peak in December, and I've asked for a more concerted effort to increase these rates. We're not going to get back to normal by treating this just like the flu. This is not the flu, still not the flu, even though it's better than it was a couple of weeks ago. And we need to get everybody not just vaccinated, but boosted. There is a clear correlation between vaccines and the impact of severe COVID. Bottom line is the vaccines work. The chart on your screens is an analysis for HHS Department of CDC data from last November before the Omicron surge. This data shows that unvaccinated adults over 18 had 13 times the risk of testing positive for COVID, 68 times the risk of dying from COVID than comparably fully vaccinated adults with a booster. Additionally, people who were boosted were more protected than those who had not received the booster. Sean's going to elaborate more on these charts, but the bottom line is the boosters matter as much as your first and second shots do. Your immunity wanes after a while and it weakens. That has opened up folks who do not have the booster to more prevalent experiencing cases more often. So that booster actually matters. We're going to continue to aggressively do outreach, marketing campaigns in communities and targeted zip codes where our booster rates are lower. As you can see from this graph, we're seeing an inequitable racial distribution in boosters. Whether it's more pop-up clinics or outreach folks knocking on doors, we're going to get the word out. And I hope you and the media will help us as well in this important message to get vaccinated. No matter how many times you do this, it actually has to be repeated. I feel like, at a national level, there's a lot of anxiousness to get past this. And there's a lot of people who, want to compare this to the flu. And I think this has, led to some level of confusion. There is no sense of urgency about getting a flu vaccine. I got mine, my friends get theirs, but nobody's like saying, I must rush out and get my flu vaccine, because for most of us, the flu is not a huge problem except for being miserable for a short period of time. COVID is worse than that. And not getting the annual vaccine, or in this case, the booster that we need right now, puts people at greater risk. And I think the more that people realize the risk they're under, the more likely they are to go out and get the booster shot. But nobody should be writing that this is just like the flu, because it sure isn't. Tonight, I'm going to be watching Governor Hogan's address in his annual State of the State. The state currently has a $4.6 billion surplus and an unexpected additional revenue stream of about $2 billion over the next 5 years. This is an incredible opportunity for state to make investments that they've needed for years. We have large unmet needs. The damage from COVID to our economy isn't yet fixed. Thousands of Marylanders still have months of unpaid rent. Montgomery County is a prime example of that. Our businesses still need more support to get back on their feet, and our hospitals have a statewide problem. Their health shortages and price gouging by companies representing traveling nurses has been a real problem that needs a state solution. Our schools and other public projects face very large cost increases due to supply chain problems. We have major transportation and climate actions that we've lamented walking away from in earlier years when there was no money. And now we're walking away from them even when we do have money. This is the perfect time to make one-time investments in programs and projects that will build our future and strengthen our communities, all communities, not just the Montgomery County community. I'm also looking forward to hearing the governor go into more details about his budget priorities and proposals this evening. However, I'm concerned that he's giving tax breaks to those who don't need them while not providing enough toward transportation infrastructure and all the other efforts that I talked about above. On environmental legislation here in Rockville, I want to thank the council for passing Bill 4421, which mandates the appropriation of 10% of the fuel energy tax revenues to the Green Bank each year. I'm a strong supporter of the Green Bank, and they play an important role in helping our county meet our aggressive climate goals. I do look forward to signing the bill, but I also look forward to the council making suggestions on what we would cut in order to make room for this, since the $17 million comes out of the revenues that actually build the base budget in the county. So hopefully there'll be some creative ideas there. The ability of the Green Bank to leverage public funds by attracting capital from commercial lenders for energy efficiency and renewable energy projects makes supporting the Green Bank a wise investment. But a critical point I want to make is it only works if it's paired with a regulatory requirement like the Building Energy Performance Standards, or BEPS as we call it. Just last week, the county joined forces with other state and local governments around the country, including Prince George's County, Annapolis, and Washington, D.C., in the National Building Performance Standards Coalition. It's a collaboration launched by the White House Council on Environmental Quality, and through the coalition, Montgomery County is committing to increase community and local stakeholder engagement to co-design building performance standards and complementary policies and programs. I'm proud that our legislative efforts not only got the attention of the White House, but also the city of Denver, who modeled our proposed legislation, introduced it in July, and passed it in November. Our legislation, introduced in July, passed in November in Denver. Unfortunately, here in Montgomery County, despite the national acclaim for our efforts, this legislation remains stalled. I want to note that I sent the BEPS legislation to the County Council 10 months ago, and it's still sitting there. I also sent amendments to expand the Commercial Property Assessed Clean Energy Program, CPACE, as it's called. These two bills would make a meaningful difference to addressing climate change in the county, and I urge the council to move quickly on both of them. It took the council 6 months to approve the International Green Building Codes for new buildings. I'm grateful that the council ultimately approved the regulations in late September 2021, but I am puzzled why it took so long. There's no achieving climate goals if emissions in existing buildings as laid out in BEPS are not addressed. So introducing the BEPS bill to the council, only one public hearing took place last July. Since then, 2 Transportation and Environment Committee work sessions have taken place. They've scheduled a 3rd work session, but they haven't scheduled it. They've said they want a 3rd work session, but still have not scheduled it. And they cited the Department of Environmental Protection technical report that they want to see before moving forward. This is just a stall tactic, since the technical report's intended to inform the regulations that will follow the legislation, not the legislation itself. BEPS deserves a vote, and I urge the council to act on BEPS before its 1-year anniversary. After the council approves BEPS, they're going to get the proposed regulations, and they will have further input in all of this. There is no way that this doesn't go forward as a collaborative effort. We're anxious to get this done. Delay in enacting this, is a delay in being able to implement things. The CPACE legislation transmitted by administration is another piece of legislation that has been slow to move. I transmitted CPACE to the council in October of last year. It still has yet to have a Transportation and Environment Committee work session scheduled. Administered by the Montgomery County Green Bank, ironically, CPACE is a critical program offered by the county for building owners to make their buildings more energy efficient, reducing operating costs, and reducing greenhouse gas emissions. The amendments proposed in Bill 4621 expand the access and scope of this existing financial tool to achieve our climate goals and improve the resiliency of properties in the county. Again, the sooner we act, the sooner we can start putting these things in place. I'm now going to turn this over to Dr. Bridges, Sean O'Donnell, and Dr. Stoddard for their updates.
Good afternoon, and happy to join our county executive again on another press conference. A couple of quick updates before I turn it over to Mr. O'Donnell. As Mr. Elrich indicated, we've begun to plan for and prepare for our under 5-year-old vaccination strategy. Based on census data, we estimate that we will vaccinate about 59,000 children in this cohort, which is our last cohort. The vaccination strategy will mirror 5 to 11-year-old vaccination strategy, where we will use county hubs that are geographically placed to support our lower vaccination uptake in parts of those spaces. School sites will also be considered. So we're having conversations with our Montgomery County Public School partners and our community partners, as well as our independent school partners. Large childcare providers are being considered as well in a similar manner. Also, along those lines, we can anticipate that once the vaccines are approved by FDA and then by CDC's ACIP, that we will have those primary care providers, pediatricians, to play instrumental impact. We encourage all of the families to begin to have those conversations with their primary care providers as soon as possible. The last point I want to just briefly touch on is that, over the past 3 weeks, we've had discussions. We've had a follow-up town hall regarding our early care and child care providers, and we've reviewed extensively the guidance by the CDC and by MSD and MDH, and there were some questions around our guidance and recommendations. And so we will have a meeting again tomorrow with our Public Health Advisory Committee to look at those metrics, as we've done before, to look at the data to make sure that they're no medical concerns, and we are prepared to realign our guidance in accordance with CDC and MSDE and MDH next week. Sometime next week, we have to have follow-up conversations once we meet as a team, our public health team and our early childhood team, under Health and Human Services, I should say. So that's forthcoming. Just wanted to provide an update. I'll stop there and turn it over to Mr. O'Donnell to give us a walkthrough and update from our post report.
Thank you, Dr. Bridgers. So some of the data the county executive has been kind enough to highlight as far as our declining case rates, our positivity, our hospitalizations. I just wanted to take a few minutes to look at what we've seen now that we've gone through January and now that we are on the downside of the Omicron surge. As we've shared previously, we are looking at both hospitalizations and data related to deaths that have been attributed to COVID. And when we look at the month of January and the 144 individuals who've tragically passed away from COVID, that is more than we've had over the last 6 months combined. So it's been a very serious month for us. And certainly we believe that number would have been worse had we not had high vaccination levels in the county and good boosted levels in the county, but it likely could have been better as well if we had more people boosted. When we look at the data that is now available, the CDC has been tracking data by vaccination status and now is tracking it by boosted status. They update it approximately once per month. The one thing that we'll share with you is that the death data for CDC does not, it usually trails by about 6 weeks from the current date, because it takes a little bit longer for them to have data that they feel confident on from mortality submissions across the country. They don't utilize and they don't get data from every jurisdiction. Notably, Maryland's data stream was disrupted, as we know, during December. And so that's not included in this national data, but it does represent, in those 28 US jurisdictions, it does represent more than half of all Americans. So this is very significant data that shows that being fully vaccinated decreases your risk of COVID by 4 times and your risk of death from COVID by 15 times. And when you look at the boosters, it's even more significant. It's the protective effect of the booster, and this the diagnosis of COVID data for CDC goes all the way up to December 25th. So through the significant early portion of Omicron, and they still saw that protective effect from being boosted, that increased your protection up to 13 times over someone who is unvaccinated. Fairly profound emphasis for being not only vaccinated, but getting your booster. We saw that the protective effect through November, when we were dealing mostly with Delta, was on the order of 68 times over not being vaccinated. As we've seen from the county data, that protective effect went down a little bit with Omicron, but it's still a significant protective effect when you see a county like Montgomery County that has high vaccination rates, the highest booster rates in the state, still had deaths that were far below the population distribution that we have within the state of Maryland. The reason why we bring up boosters again, as the county executive said, we really have a long ways to go in protecting all of our populations. Our 65 plus, 74% of them who have received 2 doses have actually gotten a 3rd dose. And while on the surface that sounds very promising, what we've seen as we've looked closer into the data is that there is a disparity between who's come out for the boosters. And it has been a more significantly lower rate with our Hispanic populations and our non-Hispanic Black and African-American populations. And we're really looking to increase those boosted totals with all populations, but particularly where we have those lower uptakes. As you can see from the upper right panel, our county has seen all of our populations come out in high numbers to get a first and second dose. But it's the booster dose where we're seeing those disparities. And we'll be working with our PIOs in an outreach campaign to try to reach all of our populations and increase those rates for boosters. When we look at where those rates are with currently the youngest eligible groups are 5 to 11, we actually have made some significant progress in getting more Hispanic and more Black and African-American populations to come out. The disparities that we saw early on in that age range are starting to close. And so we're very appreciative of the parents who are bringing their kids out and of our MCPS partners who have given us wide access and helped us identify the schools that can help us increase initial vaccination rates amongst this young population. This is having very tangible effects. We're hearing from principals who are having more and more in-person classes following an exposure to a class of a case because they have enough students now who are fully vaccinated that they can keep conducting those classes in person. And that, of course, our end goal with our school populations is to keep kids in school as much as possible. So again, our appreciation to the parents who are bringing their kids out to get vaccinated. We still have a ways to go with this population, but we'll keep working on bringing the vaccine to them. The one last thing I wanted to share is we shared a graphic with slightly updated numbers with our rapid test kit distribution. Those numbers are changing so quickly because of how quickly we are getting the test kits in and how quickly we're getting them out to the population. And we're continuing to work with our nonprofit groups to ensure that we can get distribution out to individuals who are unable to get pickup kits at libraries. Again, we remind folks, you're able to, when you go to a library, pick up 2 test kits, which is 4 tests, as well as 4 masks. So again, you don't have to just pick up for yourself. You can pick up for others who can't come out. We're working on having more modalities to get those test kits out, including drive-through access and other places. But again, we're trying to make sure that these are accessible to everybody in our county. With that, I'd like to turn it over to Dr. Stoddard for additional remarks.
Yeah, I only have a few additional remarks. First off, I want to recognize that Novavax did submit for their emergency use authorization this week, another local company doing great work in the COVID-19 space. And obviously, this is the first protein-based vaccine that's going to potentially be on the market, which obviously should help address some of the hesitancy that we see in certain populations who may not be interested in the mRNA technology, given its more recent history and development. Whereas a protein-based vaccination is a much more, long historic history of protein-based vaccinations being successful. So great news for Novavax. Obviously, this comes on the heels of Maxim Biomedical being approved or seeking an EUA receiving an EUA for their rapid test kit, which obviously we're going to be working or meeting with Maxim to see an opportunity for the county to partner with a local business to maintain a stockpile of rapid test kits for the future. So obviously we'll be setting up that meeting over the coming weeks. I did want to highlight a couple things. So the county executive and the public health team will be meeting with the hospital CEOs on Friday to try and discuss the impact that has been felt by the hospitals and just to hear their concerns and potentially some of their needs moving forward on how we can help them address what has been a hugely impactful pandemic and even more recently Omicron surge for our hospitals in terms of staffing and the costs that they have to endure on their systems. Then I also wanted to highlight some of the things that were brought up during the Board of Health meeting on Tuesday, the reflection of the partnership with Montgomery County Public Schools, the improvements that we've made in the contact investigation process with the school systems. So they have some additional contact tracing staff. We are now partnering with them to provide some of the 100 or so nurses that we brought in to do the diagnostic testing, for example. Will be utilizing some of their additional time to support the contact investigation process in the school system, which should help to reduce the burden that is felt by the frontline in-school administrators and allow them to focus more on education. So obviously that's been an important partnership as well. And so we'll continue to help support MCPS in their needs, and they've been a great partner for us as well. We will be providing them additional rapid test kits this week, in addition to the 100,000 or so that we provided to them last week. And so obviously that's been something they requested, and that's the other need that we're helping them meet. I think Mr. O'Donnell alluded to the homebound populations. I want to make sure that we're clear on that. So if there's someone who's homebound who feels like they need a kit, please do let us know. They can call us at 240-777-2982, or they can email us at c19vaccination@montgomerycountymd.gov. We will identify them, and we will partner them up with one of the nonprofits that we are providing kits to help get them a kit delivered to their house. Obviously, they also can access the federal kits through USPS, which can be ordered online and will deliver to homes. Obviously, so there are multiple options for our homebound residents. We've heard that concern. It's been a concern that we've heard several times. I think it's a matter of people not necessarily knowing that they can call, and we'll help set up a delivery to them. But obviously, we need to know where those individuals are at and have them make their need aware to us. We're not just mailing kits to everyone's house. And so thank you very much. That's where you can order the free test kits from the U.S. government on screen. So that's all I have for today. I think we're going to go over to questions. I'll turn it back over to Barry.
You are correct. And we do have a few questions here in the chat. Just to remind reporters, if you do have questions, please drop them in the chat. Our first question is from Kate Ryan from WTOP. She has a question for the county executive and Dr. Bridgers.
And this may also go to Dr. Stoddard as well. On the boosters, you have a population who clearly is okay with being vaccinated if they're ready to get their booster. Do we understand what's behind the drop off in people coming forward to get a booster?
So, Kate, great question, and I'm sure Dr. Stoddard and Mr. O'Donnell can weigh in. So we've had previous discussions early on when we talked about vaccine hesitancy and apathy. We actually worked with the University of Maryland to do some analysis regarding not only by race and ethnicity, but party affiliation. And so we re-examined some of those characteristics. We know that vaccinations and vaccines and boosters work. Clearly, Mr. O'Donnell articulated that, and Mr. Elrich indicated that in his opening remarks. And so we are working with our public information officers and our communications team to get the message out that it's more efficacious to be vaccinated and boosted. We know that the vaccines wane over time, and as we go deeper into post surges, now we have messages, and we'll craft messages to focus on the importance of being vaccinated and boosted. We continue to work with those populations, as Mr. O'Donnell indicated in his heat map, where we've seen lower vaccination rates. So it's not specific to just being boosted, but we want to get those folks, that 16 or 17% of the county who's not vaccinated, and then get those folks who are within that range 5 months to get boosted. And so we're working on that now very aggressively across the board. Gentlemen, please add anything else to, if I left off anything.
Yeah, I would say on the causality, I think we're seeing it's a nationwide phenomenon. It's not, our rates are actually higher than the nationwide numbers are, which is what you'd expect in a county that's as heavily vaccinated as Montgomery County. But what you've seen is a national trend where people have not come in and gotten boosted with the same level of urgency that they felt with the original vaccine. I think that's for a couple of reasons. Number one, I think the messaging from the CDC at the beginning of the booster / additional dose launch was very confusing. People didn't know, is it only for seniors and compromised? It was messaging on you're able to get versus you should get. Some of that early messaging, I think, was really counterproductive. And I think there was a lot of debate that was happening as to whether we should be giving boosters pre-Omicron, because, you know, the original doses seem to be operating pretty well against even Delta. And so obviously I think that, that a lot of the messaging really shifted around Omicron. And, you know, it takes, when you have one message out there, it takes a long time to adapt that message to have change in people's mind, what they think about the issue. So that's part of what we're talking about with the increased messaging, is to make sure people understand that, yeah, you not only are you eligible for it, but you really need to come in and get your booster. As the county executive alluded to, our return to normal requires that we not just get the booster, but we also maintain our level of vaccination as the you know the months and potentially years of living with COVID continue. It's not just a one and done or a two and done process. And, you know, if we want to have periods where we don't need to use masks because our hospitals aren't filling up, that relies on us as a population committing to maintain our level of vaccination, whether that's three doses or, you know, there could be a fourth dose next year at some point, et cetera. So it all comes down to having people understand that there's a sort of a responsibility that we all have to maintain immunity that wanes. And if we don't maintain that immunity, that's when we see the hospitals suffer and the healthcare system fall behind. And that's when we are forced to take actions that protect the healthcare system that people don't like masks and other limitations, canceling events, things like that. So obviously it's all part of, you know, if we all want those things to be able to continue and not have to do some of the things that we've had to do over the last 2 years. But that just requires that we have people understand that they have a responsibility to help us, and we have a responsibility to make it as accessible and easy for them to access as possible.
And just one point, just to add, Kate, as Dr. Stoddard and the county executive indicated, there isn't one universal message. So we have a very diverse population. So we need to look at that messaging within populations, across populations, and in those subcultures as well, because the message needs to be clear regarding the efficacy of not only the vaccines and boosters. I just want to add that piece.
Okay. And a quick follow-up, the Montgomery County Board of Education, on their agenda next week, they'll be naming the next superintendent. Mr. Elrich, I'm wondering if you have thoughts on that. And do we have an update on the number of mental health aides and experts in the schools right now? Again, I know that became quite an issue after Magruder, and I know that they've been working hard to hire folks, but what's that status? And again, Mr. Elrich, your thought on the next superintendent.
Marc, you're muted. Marc, you're on mute.
Mr. County Executive, you're muted.
I'm unmuted now.
Thank you.
So, you know, executives don't normally weigh in on selections, and, you know, I don't know the full range of candidates, but I like Dr. McKnight. Working with her has been, you know, a real pleasure. And I feel, the thing I feel bad for anybody in the time of COVID is having everything about your job come down to the one thing you can't do and make everybody happy. And I always feel like it's a tough way to try to judge somebody and weigh, you know, simply on the basis of COVID, are people happy or not? But I think, you know, when we talked about, you know, putting, you know, supports in schools, and myself and the counselor were talking about, you know, 25 people, she came back with a program that basically doubled the number of mental health workers in the schools, had a 2-year program that went to restorative justice, kind of cut new ground on what they were going to do in the school system on a really important topic. I thought that was really important. And I think she's doing important work in the school system. If she's made the permanent superintendent, I'd be very happy.
Okay, thank you. And Dr. Stoddard or Mr. O'Donnell, I don't know, or Dr. Bridges, do you have any information on, again, I think they had a handful of the 50 that they were hoping to get hired. And again, recognizing hiring is a struggle across the board, no matter what field you're in. What are you hearing back from the schools?
I don't think I haven't received an update on the numbers in terms of how many they've hired. We certainly can ask. There's actually a reimagining school safety and wellness meeting today that I can use as a methodology to ask that question.
Got it. Thank you.
All right, the next question I have is from Steve from Bethesda Beat. Steve.
Afternoon. I think Sean might be best. This is kind of a technical question about when he was kind of saying the CDC data about how more likely it is you are to end up hospitalized, unvaccinated versus fully vaccinated. The language in that the CDC has been using is, 4 times the risk of. Does that mean you're 4 times as likely or more likely, because those turn out different mathematically as far as that's kind of a technical question, but what the CDC kind of means when it's making those comparisons.
Yeah, that's a good question. And to be transparent here, one of the challenges we have with our data when we talk about who's COVID positive is limited to who tests positive. And that is that's the metric that the CDC is using here in the language they've used. So it's the risk for testing positive. Certainly, as more of the country goes towards rapid tests, at home rapid tests, where it's subjective whether the result gets reported, it has an impact on how we can track these things. But that's what they've used for this data. They've said, the initial set of vaccinations, 4 times the risk. You have 4 times, if you're unvaccinated, 4 times the risk of testing positive for COVID-19 versus a primarily vaccinated person, and 16 times versus a boosted person. So again, they've chosen that language, I think, specifically because that's the data they're using, and they're using a specific subset of jurisdictions that have provided them data that they feel confident they can use together in aggregate. So that it does come down to the methodology of how different jurisdictions collect data, but this currently represents, again, the majority of Americans.
Is there any way to sense, that's national data, how that bears out locally, for us, if we probably seeing similar trends to, the 13 times the risk of testing positive if you have a booster versus 68 times dying?
Yeah, and that's difficult because we've currently that's not coming through from our state feed, and while individual hospital systems can very often see that within their hospital, it's not something that local public health has access to, and that's why when we shared our data, we shared what that showed a comparison of those death rates within our county to the statewide rates. And knowing that we have there is some difference between the vaccination levels within our county and within the state, it gives us the confidence that one of the protective effects in our county is the vaccination rates. We do believe that that's not the only impact on those outcomes. Certainly, people who are more likely to be vaccinated are also more likely to follow public health guidance on distancing, masking, hygiene, all of those things.
And all the health metrics have gone in the right direction, but it's interesting, kind of, our deaths haven't been as bad as other jurisdictions across the country, but they have, stayed steady, and it's not a lot of people who are dying. But I'm wondering during the surge if there's anything that any of you kind of could say in terms of, is it just unvaccinated people for the most part, and that's why we're seeing that uptick as it spreads, or what might be causing that slight uptick in deaths per se?
I mean, it's the rate of deaths during Omicron has been lower for us. Of people who are diagnosed with COVID are on average having less severe outcomes, and a lot of that is likely due to at this point in the response, we have more people vaccinated, and we have more people boosted. But the aggregate numbers, that such a high number of people contracted Omicron that in aggregate, those numbers added up to more significant totals in the county.
Yeah, we talked about this in the beginning, I think, when we were starting to see the surge, is that, there was a lot of discussion about Omicron was more mild or milder. But if it's far more transmissible, even if the per case severity is lower, if you have far more cases, the aggregate number of deaths and hospitalizations goes up considerably, right? And so that's exactly what we saw with Omicron, where hospitalizations went up hugely and deaths went up, to a lower extent in Montgomery County, but certainly the state of Maryland. The most deaths in the pandemic were in January 2021 in the state of Maryland. And so obviously you see that we were less impacted than other places around the state because of our high vaccination rate with and without boosters. So our reduction was much greater than other places in the state. But obviously this is sort of what we talked about. That's why, I've been very careful in the way that I describe, and the public health team has been consistent with this, is when we talk to the department, we took the Board of Health, cases matter less than they did in the beginning of the pandemic, but it's not that they don't matter at all. And that's a reflection of the fact that cases will ultimately predictively tell us something about hospitalization, which hospitalizations lag cases, and they tell us something about those. And so when we saw the huge surge in the number of cases, even if it were a lower percentage of those that ended up hospitalized and ended up dying, it was still, because of the huge numbers, going to be a significant total number of people who end up getting hospitalized, which we saw as the surge and the stories that we heard from Councilmember Rice's family experience and others showed us that it was sort of that's the end result. Now, obviously, our percentage of deaths across the state in January was much lower than our population-based percentage, and that shows you the true value of the efforts that our residents made to get vaccinated, and the efforts of county government in providing those opportunities. So that was, there was real benefit that was showed there.
Regarding the mask mandate, it's interesting. Last fall, I felt the Board of Health, when these decisions were being made, it was a 7 or 14-day window. Now we have February 21st as kind of the drop dead date. If the numbers continue to plummet in terms of hospitalizations and cases, is there any chance where that might be moved up a week, or is it going to be held in terms of stay on the cautious side? I mean, I'm just curious where that stands, I guess, that policy.
Well, the Board of Health will make that decision. We'll provide them the data each week. They haven't, let's put it this way, there hasn't been a request for an alternate recommendation, nor have we offered one. But obviously it's a day by day, week by week assessment of the numbers that take place. We'll be before them again on next Tuesday, which obviously is about little more than 2 weeks before the expiration. So that's the 8th. And so when we're before them on the 8th, if we've got another week of reduced data, I don't know what they predictably will do, but obviously that's their prerogative. We'll provide them the data, and they'll obviously, and they may ask us for a recommendation, and if they do, we'll provide one. But obviously it'll be up to them to decide whether it stays the 21st, it gets shortened, or it gets lengthened. I don't think I have no reason to believe it would be lengthened, but obviously that's their prerogative as well.
Because it's interesting to see, and the county executive got into this a little bit, Anne Arundel, I think, and Howard just lifted theirs. From the public health perspective, is that too soon? I mean, I saw some commentary on Twitter, which is always interesting, but what do you make of these other jurisdictions in the region, lifting and kind of the effect that's going to have on you guys?
Well, I think at various points we've lifted things a little, sometimes too soon, and it's seen resultant, increases again. I think that from our perspective, the fact that we said this a while ago, and it goes both ways. Hospitalization should matter more as we get more people vaccinated. We should focus less on cases and positivity, which are both improving much more rapidly than hospitalizations are. And so people, when we talk about implementing things, they say, oh, no, you shouldn't implement something until you see the hospitalization rates go up. Well, hospitalization rates still fall in the high category. They're coming down. I would expect they're going to be in moderate over the next week or so, but they're still in the high category, and still, there's still a burden on our healthcare system. And so, given the trends in positivity and cases, I would expect that to fall off very quickly, but obviously it has not fallen off all the way yet. They're still in the high category. So, obviously as hospitalizations come down, that's the last sort of metric that we would look at and We certainly recommended the 3 metrics be looked at together. The 2, the case totals and case rates and positivity have improved markedly. Hospitalizations are improving, but they're just have that normal lag built into them. And so I would expect that they'll get there, and then obviously we'll feel much more, much better about the mask mandate decision at that point.
Thank you.
Okay, I don't see any more questions in the chat, so we'll do our normal countdown. Going once, going twice, 3 times. No more questions. Want to thank everyone for joining us today, and we'll look forward to seeing you again next week. Thank you very much, and stay safe.